The number of confirmed cases of coronavirus worldwide has passed 25 million, with more than 840,000 people known to have died from COVID-19. The United States and Latin America continue to have the highest number of cases, but India has reported more than 78,000 new coronavirus cases in 24 hours. That's the world's record single-day rise so far. Well, let's go live to Mumbai and get the latest from our correspondent, Yogita Limaye. Yogita, help me understand these numbers. Is it a rise in cases or just better testing?
Well, that's what the government is saying, and India has certainly ramped up its testing, over the past week. We're now testing about 1 million samples a day, and just to sort of compare that, the US, for example, is testing about 750,000 samples a day. So the government certainly trying to say that we have more people testing positive because we are testing more. However, Krupa, even with that number, 41 million samples tested so far, that's really a fraction of India's population of 1.3 billion people. And along with the fact that the counting of deaths in India is not watertight, I think most people agree that the data we're seeing from India right now is underreported. What the government is, though, saying is that the death rate, which is the number of deaths as a percentage of the population, is low in India. I've spoken to several doctors and public health experts over the past several weeks who agree with that. No one really is able to explain why that's happening. But I think the worry for India is clear. India's coronavirus graph, the curve, is growing, it's rising. There is no indication about when that curve will begin to flatten. And we look at these as numbers, but these are people losing their lives every day, and around 1,000 Indians are dying of COVID-19 every single day now.
And linked to what you're saying, Yogita, there's been a lot of emphasis on those urban centres, so Mumbai, Delhi, Bengaluru. But there is a concern about the rising number of infections in rural areas as well, and the capacity of those areas to cope with the infection. Explain that to us.
That's right. I mean, when we were sort of at the worst phase here in Mumbai, we saw that people were struggling to get care, struggling to get to a hospital, get oxygen, get ICUs. That situation is no longer exists here in this city. But this city has the best health infrastructure in India. Whereas in a rural area, a hospital is often literally a building. There isn't, a doctor there. There isn't medical equipment there. So COVID reaching those places certainly means that there are going to be people who do not get the care that they need. What the government says in this regard is that, that's lower density in terms of population. So we will hopefully be able to manage that infection better. But for India, the problem is all of this is also coming at a time when the economy cannot afford to stay closed anymore. In fact, the government has just released guidelines saying that they're going to be further sort of easing restrictions from the 1st of September onwards.